different. So as Michael implied, I can't seem to keep a job. I've done virtually everything in the field. I've been the commissioner of mental health. I've worked on an assertive community treatment team. I've been liberalizing benefits at Blue Cross Blue Shield as my part-time job to pay for unpleasant things like college tuition. And my dream job is to be the doc for the National Alliance on Mental Illness. Kathleen is a friend. Everybody in the NAMI group, family is a family. And so I try to say yes to all requests from the NAMI community. So if the talk goes poorly, I want you to blame Kathleen. If the talk goes well, Kathleen gets some credit. So it's a big topic and it's a wide open topic. But let me start with a few observations. How many of you saw the Center for Disease Control study last August? This showed that 41.9% of Americans, adults, were having significant mental health challenges. So you have probably felt this in your life in one way or another. That survey was remarkable for a few reasons. It was pretty much a real-time biopsy. So, it was online assessment of about 6,000 people using standardized tests that you would take in your primary care office. The PHQ-9 for depression, you all know, the GAD-7 for anxiety, a trauma scale, a relapse scale. And what we learned is that huge numbers of people were reporting clinically significant anxiety and depression, and that was from June. And so it's hard to imagine it's gotten better since then with the continued isolation and anxiety, depression, trauma and trauma responses. This is right after the murder of George Floyd, and relapse. 13% of people were having relapses from their sobriety. So what I took from this and from my conversations with the media, at NAMI, we are cool now, which is amazing because I'm like the most uncool person. And for 10 or 15 years, I've been working as NAMI's part-time doc, and the media conversations I would having would be around mass shootings and mental illness, guns and mental illness. I would call people back and I'd say, I'm happy to talk to the Wall Street Journal on guns and shootings and mental illness, but there's a lot of people getting better. There's a lot of people helping each other. There's a lot of people getting on clozapine. DBT is saving lives every day. Would you consider covering those stories? And they're like, yeah, no, but we will call you next time there's a mass shooting. So what happened in this year, while people were experiencing what I consider mental health went from a they thing to a we thing. Because virtually everybody knows somebody who's struggling with it. That includes people in the media. And so I got 300 media individual requests last year. None of them were about mass shootings and mental illness. They were all about coping, anxiety, depression, relapse, how to access care during the pandemic. And what I came to realize quite quickly was this is a moment in time that a silver lining of this pandemic is that people are understanding that mental health is a real wave of the pandemic and a part of life that many people had hoped to pretend wasn't true was now omnipresent in their lives. And this is, I think, an opportunity for a lot of different things. So in that survey, I just want to let you know, the number of people who were reporting suicidal thinking in the last 30 days was very high. The number of people who were having clinically significant symptoms were very high if you were a young person. This is young adults, 18 to 24, less so 25 to 40, but big chunks. If you were an essential worker and didn't feel that you had the option to work from home, if you were an unpaid caregiver, you had extremely high risk of mental health challenges and thoughts of self-harm or suicide. And if you look at the NAMI community, that's a lot of unpaid caregivers. If you look at young people across America, I think this is one of the great intergenerational transfers of pain that I've ever seen. So Don't say anything bad about young people. No making fun of Gen Z or millennials. They are giving up their developmental moments of finding relationships, finding identity, getting out in the world so that people like me with gray hair have less medical risk. This is happening all across the world. You look at the international studies, young people are having the most mental health problems, the most addiction problems. And so I think it's really an opportunity that will change the face of mental health because the younger generation not only has more of it, they're more willing to talk about it. And so I think what we're going to see is a sea change in the way people approach mental health. I've been approached by a bunch of HR directors to talk about benefits, culture, and structure of mental health in the workplace. I probably talked to 2,000 of them through different Zoom calls. I never talked to an HR director in my life, right? And so maybe to run into them for coffee at one of my jobs and say hi, but they actually are now interested in mental health in a way, and they're interested in the workforce, and the younger generation is going to want access to services. This is all different. This is a completely different world. One of my clinicians once said to me, when you see something, you can never unsee it. And I think that we're not going to have a light switch back to mental health is the forgotten about corner of healthcare. I actually don't think that's going to happen. I think this is the kickoff of a transformation. I'm writing a book about mental health and recovery. And this book, called The NAMI Guide to Mental Illness and Recovery, would not have sold 5 years ago. I just know that. In fact, I had so many people in the media asking me these questions. I thought, it's probably the time I should write that book that I always wanted to write. And to my surprise, 5 publishers bid on it. This is more evidence that mental health is a we thing. Now I live with the low-grade panic of having to write the book. Like, that's my problem. And also, I can't blame anyone else. I just want to make that clear. I can't say contracting didn't get back to me, or I think that email, it's my name on the book. So I think the announcement is coming out today or tomorrow. But to make a long story short, this is a sea change moment in the field, in my opinion. And the field has also done a pretty good job. The mental health field has never been accused of being fast moving or particularly nimble. And as you know, within 3 days, you've probably been part of this. Teletherapy was pivoted within 3 days. And so what was a country back road became a 16-lane highway. I know many practitioners who are abandoning their office. They don't want to pay for an office going forward. They're going to do telecare. And at Blue Cross, we saw an explosion of telehealth from like 200 visits a month to 40,000 in the mental health space. We knew before the pandemic that teletherapy, which I'm defining as video-enabled therapy, was as good as in-person care. We actually knew that. That's well established. Because Andrew Dreyfus is a really good guy, I pitched to him that we should cover phone sessions because some people don't have the internet, don't have the access to privacy. And from an equity perspective, I said, there are people who will need phone sessions. And so we covered that at Blue Cross in that part-time job of mine last summer, and then the legislature mandated it. So if you don't have the internet or privacy, your health plan has to cover phone sessions now. The difference between phone sessions and video sessions is that phone sessions are unstudied. We have no idea actually how good they are, but we're going with this from an equity perspective, like nobody's run that study. So video-enabled sessions are well established to be as good. They're well established to be as good as in person. So that's a transformation of care. The demand has exploded if you think about the CDC study, and the supply is fixed, right? And so this has created the Sagamore Bridge traffic jam. My heart sinks when somebody asks me, do you know a good therapist who could see my son, daughter, brother, myself? Because, it took 8 months to make a true mental health crisis on top of the prior mental health crisis, but it takes 8 years to make a social worker, right? So the supply is slow and the demand has exploded. So I know you saw the roadmap to recovery, the DMH presentation. They're going to try to reduce the chaos and fragmentation in accessing care, the idea of a no wrong door. They're doing this in Georgia, actually. Georgia has kind of a one-stop shopping access and referral line. It's very interesting. Like, this is possible. This could be done, and it's going to take a lot of interested parties to stay on them to help them do that. So the pandemic has presented us with a lot of challenges. It's normal for us to have anxiety with uncertainty. There's been a lot of grief that has been really impacted adversely by the pandemic. I lost a family member about a year before the pandemic. It was a very, very difficult experience for me. But I was able to sit with him, my brother, for months on a ventilator and love him up and bring him the Philadelphia Inquirer and make dumb jokes with him and listen to the baseball games at night and, the things that he liked to do. I was with him. And it would be almost unimaginable to me to suffer through that without the feeling that I had been able to be there for him. I think it's just an incredible addition on grief that we're going through now. The people who have suffered this loss, I mean, it's just a whole nother dimension. And Alan Kusher, who's a fantastic psychologist at Blue Cross, is a specialist in grief, and he's really taught me that Zoom events are essential, that you have to find a way. Zoom Shiva, Zoom wakes, Zoom funerals, you have to do them because it's partly the expression around the person, and you can't give up. And of course, what's nice and safe are old school cards for people. And I had an enormous stack of cards that I read and reread over the years. These during my little grief process. And this is something we can still do in the pandemic. Remember at the beginning of the pandemic, sending mail was a problem? Are you allowed to? You can send person a nice sympathy card. They will benefit from that. What's nice about that as opposed to other contacts is they can read them whenever they want. So the old school is connected to the new school. So teletherapy and the phones are great, and old school connections are very helpful. I mean, I think of people as low-key antidepressants and anti-anxiety interventions. And that connection is really good for us. We're very social creatures. And I think a lot of what's happened to people is, the loss of that. So if I was a pharma company, I would say people have low-dose antidepressant and anti-anxiety elements. Side effects may include battling over the dishwasher. I think the idea people are really good for you, and the loss of connection is really hard. And other than struggles over domestic life, the dishwasher is my favorite example. The loss of people has created a lot of heartache for people. And so finding ways creatively to get connected. So NAMI's made a nice pivot. We do a lot of programs online. I think that's been really valuable for people. AA has become quite a great resource for people online. I have a physician friend whose life was saved by AA. And he says, what's interesting about AA, Ken, is when you're on Zoom, only one person is talking. So when I'm at a meeting in person, I'm usually staring out the window looking for birds. And when I'm on Zoom, it's one person talking to me. I'm really attending to them. So he does 2 meetings a day. It's a full-time practicing doctor, but he's made a decision. This is what saved his life, and it has, in fact, turned out to be a great life. But he was in a lot of trouble. So, the power of these technologies to stay connected and the creative ways to employ them is, I think, really invaluable. I have been to the American Psychiatric Association annual meeting for 30 years. I never went to a pandemic mental health class. Never. And, I like to tell people this is actually my first pandemic. And a lot of this is about mental health and mental illness. And a lot of it is adjacent to it. So it's creative, resilient, engaged, coping strategies. And people who have mental health conditions are often having more difficulty. Like, both things are true. The mental health side is real. We know addiction is up. We know overdose deaths are up across America, right? This is related. So it's coping, creativity, connection, and then how do you find services for people, who have more serious needs? So I thought I'd prattle on for 10 or 15 minutes, and I seem to have done that. Let's have a conversation, which will involve what you've learned and what you've seen. Remember, this is my first pandemic, and so any idea that I'm an expert should be moderated by the fact that, I'm making this up as I go too, just as you are. But I'm happy to talk about it, and I'm interested in what you've seen, what's working for you, what questions you might have. So I'll stop there, Michael.
Great. Thank you, Doctor. Yeah, if folks have questions, feel free to raise your hand, unmute yourself. If you want to put your question in the chat, you can do that, or comment. You answered a lot of the questions. I definitely had a question about telehealth, because I know in preparing for this, I heard one of your interviews on GBH, and you talked about telehealth being a game changer. And it sounds like from what you're seeing, the video sessions are proven to be effective.
Well, that was known, Michael, before the pandemic, but nobody did it. Because, you're trained to have an office, have people fight traffic, pay $10 for parking, wait in a waiting room, right? That's what you think care is, because that's what you were trained to do. Well, it turns out there were studies, and in rural states, I consulted to Oklahoma and Alaska. They've been doing telecare for years because they simply have no practitioners. And if you're outside of Oklahoma City and you need mental health care, you're doing it through tele, right? Half of all counties in America have no psychiatry at all. So tele is something that had to happen sooner or later. And I think we were inching into the water, and then we all got thrown into the deep end. And the vast majority of people find it helpful. People with developmental vulnerabilities, people who are paranoid of technology. It doesn't work for everyone. I mean, I think it's really important to respect that. It is a brilliant workaround for most people in the bell curve, but it does not solve all problems.
And what about more critical cases? Would telehealth apply there?
Well, IOP, intensive outpatient, partial hospital, these things are all being done through tele, because how else can you connect to clinicians without generating risk in the middle of a pandemic, right? Inpatient care is still inpatient care. Detox is still detox. That you can't do everything through technology. You still actually need people on the ground. And again, you look at the impact of healthcare professionals of the pandemic. I mean, it's been traumatizing, stressful, overwhelming for a lot of people in the healthcare space. And you know about the emergency room physician who died by suicide. That was well publicized last May or April, I believe. She simply couldn't bear it. And so, this then, for those of you in the healthcare field, how do you create a culture where people can ask for help? People can take breaks. And I know that's easier said than done because there's a lot of work to be done. But I think that recognizing the traumatic impact on the professionals of all of this is just another dimension to it that's just important to attend to.
Kathleen?
So, Doctor, you've already talked about the pandemic, and we all know that it kind of turned the world upside down. There are so many uncertainties that remain as far as education in general, vaccination of children, the economy. So how do we live in this new world, kind of managing not only our own anxieties, but anxieties of our family and also of the people that we serve? Have you got some techniques that we could kind of bring away here?
Well, it's a good question. And again, like I've said, it's my first pandemic. But first thing I encourage people to do is not fight their anxiety. We are wired to have anxiety. And if you think about it from back in the day, we're around a fire and we have a great day. There's a great harvest. or we've killed a giant mastodon, right? Great day, right? But the fear response that is inside of us for a predator, right? A gaggle of wolves turns up around the fire. That's what your brain is going to remember. We are wired for fear. If you look at anxiety studies and dreams, most dreams are anxiety, fear driven, right? This is inside of us. If you haven't been chased in a dream, if you haven't showed up for an exam that you haven't prepared for, if you haven't given a talk naked, right? You haven't been paying attention to your dreams, right? Your body is wired to anticipate anxiety or fear, right? It's over prepared for that. So what do we have? Instead of a mastodon, we have a microscopic little packet of DNA and proteins that could kill us. You can't see it. You can't know where it is. So anxiety is normal. Accept it. So don't say, oh, I don't want to be anxious about it. It's normal. Be anxious. I've been anxious. Again, this is in the creative, resilient space. What are the things that we know work for anxiety? We know exercise works, right? We know being outside works. We know aerobic exercise is kind of natural beta blockade. So if you can get your heart ticking while you're outside, right? If you can walk up a hill or on a bicycle, that's better for you than not being active. I have no media inputs after 3 o'clock. I found this particularly true before the election. I realized all the bad news would be waiting for me the next morning. And I was starting to approach this like espresso. You know, like I can't have espresso after lunch, right? It just keeps me up. And so I would read the news at night. I'm like, I can't actually do this. It's like really bouncing through my head in a very terrifying way. So aerobic exercise, being outside, sunshine, particularly if you have seasonal affective disorder, consider getting a light, which most health plans pay for, but be outside. Like in a rare moment, it's a sunny day. Find a way to get outside. Do a call, you know, on the phone while you're walking if you can. Be as creative on that as you can. Cognitive behavior therapy would say, don't believe your thoughts. They're just your thoughts. And CBT has been shown to be helpful for anxiety, for depression, and actually for psychosis. I had the British psychiatrist who invented CBT for psychosis, and they were interested in helping the person challenge their hallucination. And the idea that you're a terrible person, which is what the hallucination is telling you, well, let's look at the evidence. What is the evidence that you're a terrible person? They do it all in a British accent, so it's so much more interesting than what I'm telling you. But so what's the evidence you're a terrible person? Well, you know, and then they do a role play. Well, I stole a comic book when I was 9. That's not very terrible, is it? Right? They go back and forth, and what you're doing is you're challenging the hallucinations. More fun, I think, if you're doing it in London than in Boston. But I think the idea is your thoughts are your thoughts. You don't not have to believe them. So, you know, if you were nodding off during my talk, I could have the thought, maybe I'm not really very good at this. Maybe I should, you know, resign my post at the National Alliance on Mental Illness. Maybe being a doctor was all a terrible idea. That's an automatic stream of negative thinking. Another possibility is these people don't seem that into the talk. Maybe they haven't had their coffee, right? So the same thought is, I notice people aren't paying attention. That's not actually happening. I give an example based on real world experience, right? So the conclusions that you draw from the observation, you know, it's very important to pay attention to your thoughts and recognize them simply as thoughts as opposed to believing all your thoughts. Critically examine your thoughts. This is the essence of CBT. Works for anxiety, right? I'm anxious. My body is anxious. That's why you exercise, because you're physiologically reducing the feedback to your brain, which is fear, scared, fight or flight, right? You're trying to reduce that by moving your body. And then you're also minding your thoughts. Terrible things are going to happen. Terrible things will happen. I can't control what's going to happen. Recognizing those thoughts and keeping some attention to what you can control and that they're just thoughts. And then, of course, action. If you can get a vaccine, get it, right? And I know there's conversation about, one of the vaccines right now and it's offline and the risk is less than 1 in a million for women. It's hard to know how to place that into some context, but this is a nasty virus and it's killed a lot of people. And I think it's really important to proactively get vaccinated. And for people who are vulnerable in your life, people with schizophrenia have very high rates of bad outcomes with COVID-19. There was a study done. NAMI signed on to a letter advocating for people with schizophrenia to get the vaccine as early as possible for any of you in healthcare, human services. Make sure you help those people get the vaccine if they can't advocate for themselves. That's a national problem, is that, every state is different, every rule is different. So there isn't one blanket thing you can do. So exercise, mind your thoughts, and act. Do something to actually work on the underlying act, right? And those are my 3 big strategies for the management of anxiety. I think going back to regular world is going to be weird and challenging for people. And there will be people who won't be wearing masks who are making a political statement, and there will be people who won't be wearing a mask so they're vaccinated and they think they're good to go. So I think it's going to get more ambiguous and confusing. And people who used to be a source of just endless delight, connection, and positivity are now more complicated, right? In terms of your relationship to people. I was walking my dog the other day, just yesterday, and these little kids ran right up to me, right? And they were on me and my dog, right? And I'm a new dog owner. I don't know, have anything figured out with the dog. Don't ask me anything about dogs. The dog is crushing me in terms of this. But I was so conscious that these human beings were right next to me. I haven't had strangers next to me. These little rugrats, they didn't know about social distancing. They were 3, 5, and I was just on a little. They just ran up to me to meet my cute dog, and I'm like, what are these human beings doing next to me? They're not even wearing masks. They're just little creatures that are on me. And old me would have said, "What great-looking kids! How adorable kids!" I would have chatted with the parents, and my response was now fear-driven. Oh my God, what are these people doing near me? Have you ever watched a movie and they're in a scene where there's a lot of people and you've had the thought, they're not wearing any masks, right? I've had this thought, like, what is this, right? Like, you're trying to process the experience of the new challenge of public health. Do you think Massachusetts overall is doing a pretty good job? I don't think it's perfect, but advocate, get in line, pursue it, and help people who are vulnerable get the vaccine. That is really the pathway out. Is activating the vaccine. If you live in Europe, you're going to have much less access to the vaccine. So for those of you who think the Europeans have figured out healthcare, I have often thought that we're smoking them on getting shots into arms. We're killing them. It's amazing what has happened. We have figured this out with our chaotic, underfunded public health system. We have figured it out. And I didn't tell anybody at the clinic that I volunteer at to give people vaccinations that I'm a psychiatrist. So don't tell them that actually, I'm not an internist and I hadn't injected anybody in 25 years. But I felt like, why not? Let's go. I have a license to practice medicine in Massachusetts. What could I really hurt? And what you find is people are grateful. People are engaged. People want the vaccine. Not everybody feels that way. There's historical prejudice. There's historical discrimination. There's some complexity to that. But if you get a chance to volunteer at a clinic, do it. You're going to feel great. It was, a very positive experience for me. And after the first couple, I forgot that I was a psychiatrist and I just got into injecting people.
Great. We have a few questions in the chat. And I know Liz had a question about inpatient beds. Liz, if you want to unmute yourself. There you go.
Hi, good morning. I follow a Facebook group, but I also I've been with my child and family members. I've had a lot of inpatient experience.
Yeah.
But so what I wonder about is, I understand the waiting for inpatient beds or partial, whatever, the different programs and things have gotten exasperated, and just wondering what can be done what, is there something we can do or whatever? Is there, what can be done to help the situation of people having to wait?
So at every step of the measure of the field, demand is crushing supply right now for many reasons. More anxiety, more people seeking help, and the workforce has been impacted too. There are adolescent psych units that are closed because they can't find the staff to work in them. And this gets back to the stresses on the workforce and the difficulties in the workforce. So to me, I've been arguing for loan repayment for people to join the mental health field, for people who stay connected to the field to get loan repayment. I've been pitching this idea for years. Things that involve spending a lot of money are not very popular. Did you ask the commissioner this question a month ago? Because, she has the ability to look at the field. I just commented on a national study that was done. Child and adolescent waiting for inpatient psych beds is much longer than it used to be, that your experience is being replicated all across America, right? So it's very difficult to know what to do about that. So, if you can assemble a program that's rich and keeps people out of the emergency room, like if you can construct that, that is the ideal, but that doesn't imply that you're not doing a good job if you can't pull that off. Like, it's really hard. Also, if you have a child with autistic spectrum disorder, there are 10 beds in Massachusetts. 10 beds in Massachusetts. So those beds are always full. It's easier to get into Harvard Medical School than into those beds, right? Harvard Medical School has a lot of seats. And so this is a very fundamental problem we have. At Blue Cross, I eliminated all authorization and paperwork requirements in 2014. So, as you know, I have a part-time job, which I'm leaving actually to write the book. But in the part-time job, I was like, why on earth are practitioners in mental health having to fight with the health plan even a little or ask anything? And so I eliminated that in 2014. And pre-pandemic, we were like the best example of how to get your people into the hospital, because you don't have to call the health plan, you don't have to ask us. We pay for 2 days and then we start the review. It's the same as we do on medical. This is a classic application of mental health parity and why people need to get involved in the health plans instead of simply hating them, because they have a lot of power. Right? And that's a change that I made. It's a flip that we switched, a switch that we flipped. And people would say, oh my God, I'm so happy when a patient has Blue Cross in the emergency room. What I've noticed, Liz, and during the pandemic, is even we are having problems. So now the health plan isn't the rate limiting step. Now it's capacity. So we're having more people stuck, even though we make it as easy as possible. We ask no questions. We'll give help if we can. The capacity now, we can't make more beds. And so this has become even more of a crisis than it was before. So I'm not sure I have a good answer, Liz. It's very humbling. I have done inpatient work. It's really hard. And it's really important to, thank everybody who does that work, because this work is really hard. But we do have a fundamental workforce shortage. And I think in the commissioner's roadmap to recovery, there was loan repayment ideas. I don't know if you asked about that. None of these fixes are short term, but you have to have more people in the capacity. In the supply side of the equation, you have to have more people. And not related to your question, Liz, is using peers and community supports while you're waiting for professional help. So whether it's Lisa Lambert at PAL, or whether it's NAMI, or whether it's AA, things that are not independently licensed practitioners are doing quite well. Like, the community is stepping forward during the pandemic, in my experience. And those are skills, family to family. NAMI Basics is on demand. These are things that are available to people. They're not perfect and they're not the same as inpatient care. I really know that. But they are additional resources, and in a way, that supply can continue to be grown. That supply can continue to be grown. People stepping up and saying, I've walked a mile in these shoes, and I can be of support to you.
Yeah, Commissioner Doyle definitely talked a lot about workforce development as something that the roadmap is geared towards. So be interesting to see what happens with that over time. Katie Clark, if you want to unmute yourself. Katie had a question, I think, to follow up on your point about schizophrenia, Doctor.
Can I just add one little thing that I found somewhat just important? So the way I learned about NAMI, because I love NAMI. We have a lot of fun and we can laugh about things.
Yay.
My sister in Seattle, when all this started, told me, why don't you find out about NAMI? Not one of the hospitals or like, it was not, I mean, I had to hear it from my sister. Anyway, it was just, sometimes getting that information is just very difficult. And
Somebody ought to write a book called The NAMI Guide to Recovery. I wish somebody would get on. Liz, this is the huge problem. People say to me, if I knew about NAMI 5 years ago, my marriage would have made it. If I knew about NAMI 10 years ago, I wouldn't be in this. Like, NAMI is not magic, but the feeling that you're not alone and you're engaged in collaborative engagement with other people trying to attend to these problems is really important. And, in the book, I'm interviewing people who have lived experience and family members. One of the themes I'm already hearing, which I'm not surprised by, is that the collective engagement takes people from a position of feeling more helpless and overwhelmed to active and engaged. And that itself is healing. Right. So anyway, so Liz, that's very common. But something's changing. I donated my car to WGBH. It was an absolute beater, and I only got like $1,000 for it. And when I donated my car, I said, send my receipt to ken@nami.org. And the woman at WGBH said, you work for NAMI? They're so cool. They helped me so much. Now that's new. Again, things are changing in a way. I went to get a medical procedure at the Beth Israel. And the woman said the same thing. ken@nami.org. Do you work for NAMI? I'm a social worker. I think they're really cool. And so this is a very unscientific study. And the vast majority of people know nothing about NAMI. But I'm going to hope to change that, with my little project. And you are changing it, Liz, because someone will know you and you will share it with them. And, it's an incredibly beautiful community. And, I feel very honored to try to tell the NAMI story. And my goal is to get it to every social worker, every psych hospital. This is an important resource that people can use. So anyway, Liz, you're identifying a core problem that we have, which is kind of advertising and marketing.
We definitely look forward to that. Maybe we'll even have you back, Doctor, when the book comes out. Katie Clark, you had a follow-up about schizophrenia. Go ahead.
Hi, yes, thank you. This has been a great conversation. I could ask so many more questions, but I wanted to just ask specifically when you were talking about advocating for groups of people for getting the vaccine, to get the vaccine that may not be able to advocate for themselves. And you mentioned the impact on patients with schizophrenia. Were you referencing exacerbation of psychosis, or there was a higher rates of more of the typical COVID-19 symptoms?
Medical outcomes are worse for hospitalized patients who have a diagnosis of schizophrenia. So there was 2 papers on that. One is Don Goff, is the last author. I forget the first author, but because I've worked with him, I think that was in JAMA Psychiatry. And then the Lancet, which is the British equivalent, did a large study that did, again, you're looking at hundreds of thousands of hospital records. Big data has mostly been all hype and no activity. My take, right? I mean, what has big data done for us? But these big data studies would say, let's look at all the people who died in the hospital, all the people who had severe complications, couldn't get off a ventilator, and pull out their features with big data. And schizophrenia was the single highest risk of medical outcomes. So people have to get vaccinated. The Lancet did a study that showed that other mental health problems are just almost as bad. So bipolar disorder, panic disorder, OCD, and they controlled for weight, they controlled for smoking, they controlled for things. So what is that? Is that the autoimmune undercurrent that people suspect might be a feature of schizophrenia. There was a big study in 2016, a genome-wide analysis study done at the Broad Institute right in Cambridge. And they looked at thousands of people with schizophrenia, and they tried to map their genomes to see which ones were the most relevant. And the one that popped up the most was called complement 4. It's an autoimmune factor. Now, that helps no one. There's nothing you can do about that. But it's a research thing that links the immune system, which is very germane to fighting COVID-19, and schizophrenia. So is it something about the medications? Is it something else that we don't understand? So the bottom line is, if you have a person in your life or you yourself have a mental health condition, activate to get them vaccinated. Do what it takes. Like, figure it out and keep going. And NAMI's great at advocating. So that's the key thing. Another thing is, I'm now starting to get emails for people that have developed psychosis and mental health problems as part of COVID. And so this is a new phenomenon. We thought it was all lungs with all respiration. Oh my God, you're breathing, your asthma, you're smoking. Then it was clotting. Well, now there's this whole clotting thing that's going on. People, can get blood clots and strokes. Then it's become clear that there's a mental health psychiatric dimension to a lot of this. For dementia, for people with psychosis, this is very new, but we're looking, at something between 5 and 30% of people are having mental health sequelae of COVID. Like my never having taken a pandemic mental health course at the American Psychiatric Association, this is all brand new. Because I don't think people conceptualized this potentially impacting the brain in the same way. Now, you and I all know in the mental health space that the neck connects the body to the brain. But for respiratory things, we don't usually think of asthma as having a mental health dimension, other than perhaps activating anxiety when you're having an asthma attack, right? We don't really connect it. But it turns out this virus has this pan, meaning all impact, right, of the whole body. So it's vascular, it's respiratory, it's psychiatric, it's neurologic. Like, you've seen people who've lost their toes as a result. Like, this is a very unusual beast. And it's really important to get vaccinated to stay away from it. And the vaccines don't give you COVID. People ask me that question. So the idea is you need the whole suitcase of the virus to get into your house. Then it takes over your whole house, and it uses your house as a production factory to shoot COVID at you all over the place. When you get one of the vaccines, you get the antigen that is the handle of the suitcase. And so your body says, don't pick up suitcase. It's not the suitcase, right? Don't pick up the suitcase. We've already seen that handle. So you may feel crummy after the second shot, as I did for a day. It may be your worst productivity day of the year, except for every other day. I haven't been that productive overall, right? But you can't get the virus from the vaccine. It's very important to know that. So I think as we get more people vaccinated, there is some real hope. But Katie, I was speaking to the medical sequelae of having a mental illness with the infection.
Thank you.
So if you run shelters or are engaged in human services, it's just kind of a public health emergency for your population. And if I'm any good, Michael, I can send you the links to those studies. Those studies are important to know. And I talk about them at NAMI, but as Liz says, a lot of people don't know NAMI or me.
Oh, that's great. Thank you. We had a few comments about vaccines. Kathleen from Drug Story Theater mentioned that young people in her program were all qualified during the last wave for vaccine, but didn't know they were qualified, didn't know how to sign up, didn't know if they could get it because they weren't sure about payments. So they needed information, they needed assistance, and then they were excited to get vaccinated. So kids need help, which I think is a great point. Heather from Pembroke Hospital addressing the workforce issue. Staffing is definitely an issue at Pembroke Hospital, but it's interesting to note that Pembroke has started a loan repayment plan for staff, so that's great. That's a step forward.
Creative. That's creative.
And Melissa Kenny, hello, Melissa. Just had a question about any studies related to the impact of COVID on infants and their social development.
Well, let me say I love Drug Story Theater. I'm a big fan, very big fan. Kathleen, you know I helped Blue Cross support Drug Story Theater a few years back. I'm a very big fan of that entire model because it represents empowerment in action, right? What was the last question, Michael? Infants. The answer is no.
Okay.
So this is all too early.
Yeah.
And most mental health studies are short term. This is a flaw of the field, right? So we learn things years later. So let me tell you how I learned that second generation antipsychotics cause weight gain. They were billed as 6-week studies, no side effects, no movement disorders. I'm not an early adopter of technology. Like I had a flip phone way too long. Not just because I'm not sophisticated, but also, like, well, let's see what the problems are. So I'd be at this a meeting. People would say, my patients are gaining weight on antipsychotics. And I'd say, yeah, I know. My sister just told me, she was on Zyprexa, she gained weight on antipsychotics. And I'd say, yeah, I know. My patients are telling me they can't stop eating. And so this is how we learn about the long-term side effects of second-generation antipsychotics, right? Prozac, a new antidepressant, no side effects. It's fantastic. I'm at a professional meeting. People are like, everybody's complaining of sexual dysfunction on these drugs. I know, me too. Yeah, I know, me too. My patients hate it. Well, I thought they said there were no side effects. And so what you realize is short-term studies reveal short-term data. Long-term studies teach us things. People probably aren't going to discuss their sexual vulnerabilities, right, in a study of 6 to 8 weeks or 10 weeks, but also what we're going to learn over time. So infant mental health is an unknown long-term effect. What this will do, the generation of children, is an unknown long-term effect. I have a stepdaughter who's a senior at the Boston Latin School and hates online school. She finds it unengaging and, I would say somewhere between terrible and awful. And I have a feeling when she has children, she's going to be unsympathetic to their desires to not go to school. I couldn't go to senior year. Get on the bus is what I would anticipate this generation will be saying to their children. I missed all this. I missed being the lead in the class play. I missed going to prom with the wrong person. I missed all those things that you get access to. So get out of the house and go. Like, that's a projection, but I can tell you my parents grew up in the Depression, and I can tell you a story that 50 years later, they made me drink an entire gallon of milk before we went on a trip to visit grandmother, right? And the idea was I was 6'1", 15. I was probably eating them out of house and home. Right? I was a big lad and I ate a lot. They were like, well, there's a gallon of milk and that costs 29 cents. And you are to drink that before we leave in 2 hours. You can drink it any way you want, but you have to drink it. And I thought to myself, no, okay, it seems like a lot to ask. Now, of course, in retrospect, you look back and they were so shaped by the moment of depression, scarcity in the 1930s, that in the 1980s or 70s, whatever that moment was, I had to drink that whole gallon of milk. And they weren't negotiating with me. I was instructed. Now, truth is, I probably would have drank half of it, but they were like, no, we're going to see mom. We're going for a week. That milk will be bad. You must drink it. This is like a memory that's deep. How will this generation feel about isolation and connection and creative ways to find each other and Instagram and all those things that have popped up at all new levels to stay engaged? I think it's all unknown. So it's not just infant mental health. It's not just adolescent mental health. It's not young adult mental health, not school mental health. I do think that this is going to have this is the signature event of this generation, right? 9/11 was a signature event For some people, Kennedy's assassination was a signature event, the Great Depression. I was told in Michigan that we were hiding under the desks for tornadoes. Michigan is on the tail end of the tornado alley. Of course, it was all about nuclear annihilation, but I couldn't process that because I was being told by nice teachers. So that could have been a signature trauma or event, but I was like, okay, tornadoes. And occasionally the sky did turn green outside in Michigan. So I was like, okay, it's believable that that's why we're under the desk. So that never became a generational phenomenon. John Moe, who writes the hilarious World of Depression, it's a best-selling book and runs a fantastic podcast. He talks about his experience of hiding under the desk and how he felt that that shaped him for the rest of his life because they told him it was for nuclear attack protection. So, you look back and you think, what are the things that shape a generation? And I think this is a good example. This is an impact. This is an experience everyone is having. And young people have been very adversely impacted by these public health decisions, which I support the public health decisions. But whatever you do, be really nice to young people. They've given up so much in all of this. They really have. And anyway, that's my long-winded answer. The answer is no. There are no studies on adolescent, school age, or infant mental health as a result of the pandemic. Those will be long-standing. If you look at the Chowchilla bus study, in Chowchilla, California, a bus, incredibly, was hijacked by bad people. And I know this sounds unbelievable. The bus was driven into a giant hole and buried. And there were kids who were in first grade, sixth grade, 12th grade. If you look at the Chowchilla bus tragedy, a psychologist was waiting to fly to a place where kids of different ages had a traumatic experience to look at it and understand the response. And the answer in her study is younger kids simply stopped imagining a future. Like first graders, second graders, third graders, they couldn't imagine themselves as adults because they had been traumatized and didn't have kind of a cognitive process. And older kids, right, had more traditional PTSD symptoms. So the answer is we don't know, but if you're interested in the developmental response to trauma, that's a great study. And one of my teachers, Bessel van der Kolk, wrote a good book called The Body Keeps the Score. He says it with fantastic Dutch accent. So again, everything is so much more interesting in these foreign accents. But he was one of my great teachers. And his book is that this stays in your body even if you can't process it. Right? One of the things about traumatic memories is you can't really process them normally, but it stays in your body. I won't do Bessel's Dutch accent to spare you, but it's cool. It's actually cool. So what are you sending around, Michael?
So I just put the Chowchilla study in the chat and the link for the hilarious World of Depression.
Yep.
We're all about health literacy. We're all about reading about
Good.
health topics. So I'm glad you mentioned both of those.
Yeah, the Chowchilla study is an old school study, but it's the first developmental study where a trauma happened to kids of different ages. It's the first one. And of course, people have worked on that since and done development of that since of the idea. And Bessel's book covers, all of that in much more detail. But it was the first moment somebody thought, I'm going to study how different ages respond to trauma. It's a brilliant piece of work. Kind of like the adverse childhood experience, tries to understand trauma and how it relates to later in life.
Yeah. So I just think that there's so much we could talk about. We're going to be dealing with the long haulers and the long-term impacts of the pandemic. And this is a great discussion. And I really appreciate your being here. I really appreciate everyone's questions and everyone being part of the discussion. We're going to try to track down some of those studies that Dr. Duckworth mentioned. We're going to have him back when he writes his book. So
maybe we could do it in person. All the royalties go to NAMI, by the way. So I'm not going to become wildly wealthy, even if this becomes a bestseller. So this is a love gift, right? Like NAMI has done so much for me. It's a love gift. So
it-
I'll come back, Michael. I'll sign my overpriced book, and you'll at least know that $4 or whatever is going to support NAMI. So,
And do you want to talk about your other project that you mentioned to us yesterday?
which one's that?
The Apple TV?
Oh yeah. So I'm having my 5 minutes of fame as I've gotten gray hair. So Oprah and Prince Harry are doing a thing on Apple TV about mental health, and they found me, and I'm one of their consultants, and I'm actually on screen, if you can believe it, even though I'm no longer young and even reasonably attractive. But I think I made enough sense about thinking about recovery as an integration of medical and giving to others that they decided, what the heck, let's just interview this guy, because nobody seemed to have that perspective. They have amazing experts, amazing. Like, it's like a basketball team of the NBA All-Stars, and I feel like a good high school player. Like, what am I doing on this team? But I'm on it. And so that's coming out end of May, and it'll be on Apple Plus, whatever that is.
Yeah.
And so it's 5 episodes, and amazing and famous people are interviewed with their mental health problems. And then they're contrasted and compared to ordinary people who have the same problem. It's cool. So famous person, I can't say their names because I've signed 19 pieces of paper, has OCD, and Bob the postman has OCD. And okay, famous person has more resources, but is still dealing with the same attitude, shame, and complexity as Bob the postmaster, right? Who's dealing with, OCD as well. There's people with schizophrenia. There's people using psilocybin as a new kind of ways to get at trauma. There's people who are doing exposure response therapy for OCD. So what's amazing about the series is that it happened at all. And Prince Harry and Oprah, don't ask me how that worked, became pals and made this decision to do this series, and they found me. So I would recommend it to you if you need treatment for insomnia. No, seriously. That'll be my book. I'm sure one of the endorsements on the back will say, if you can't sleep, read this book, right? So it's another step forward in this conversation. We need to have this conversation. Mental health is a part of health. It's ordinary, it's common. And unfortunately, because of the existence of this series, it's further proof that a lot of people don't feel that. And what's interesting to me about this project, it's going to run. You can binge the whole series, and in 1 week, and you can do it on Apple.com. We're having we're going to do a thing like this, a town hall with amazing people, and you're going to say, "What the heck is Ken doing on that list?" And I know, I agree, but I'm on it. And so there'll be a town hall where people will be asking all kinds of questions, and so it's good, clean fun. And I think it's in the service of our all shared mission. So thank you for your attention. And thank you for everything you do. I wish you the best out there. And Michael, I'll come back, and hopefully about 18 months there'll be a book. And hopefully it'll be the after times. Everybody will be vaccinated. You can watch TV after 3 o'clock and it won't upset you. Hopefully in the future times, it'll be a normal-ish time. And I'll just do a book signing, and I'd like that very much. So
Well,
thank you all for your
thank
attention,
you.
Attending. Have a great day, everybody.
Thanks, Dr. Duckworth. And we're looking forward to getting back to normal times. I keep joking about not getting my intake of bagels and muffins that we have at these monthly meetings. So it'll be something to look forward to when we get back to regular.
Yeah, it's true. And I managed to gain 10 pounds, even though I don't have access to free muffins and bagels. Like, how do I do it? So anyway, it's a gift. Take care, everybody. Thank you.
Thanks, Doctor. Thank you so much.
Bye now.
All right. So just a few things I wanted to go over before we wrap up after that great discussion. On the agenda, we are taking, now I need to go back to my other page. We are in the process of receiving nominations for the Health Literacy Award. Unfortunately, we were unable to do the Health Literacy Award last year, but we want to get back to that. If I can try to share my screen really quickly. There we go. So the nomination form is on our webpage. I know Kim has sent out the nomination form as well. This is a description, sort of the 6 categories or qualities we're looking for in a good nominee for the Health Literacy Award. If you can think of someone who's made a contribution to the spreading the concept of health literacy, making health information more available and accessible to folks who face obstacles to accessing accurate and effective health information, those are the people we want to highlight in our for our Health Literacy Award. That breakfast will be in June. Kim, can you remind me of the date? I always need Kim to remind me. Is it the Friday we came up with?
Friday, June 11th.
Okay. Friday, June 11th will be the breakfast, and we're trying to get nominations by the end of April so that we can have a vote on our nominees at our May steering committee meeting. And speaking of May, our general meeting, we are hoping, and I just waiting to get a scheduling worked out, to have Senator Sue Moran join us. Senator Moran is the relatively new senator from the Plymouth area. She covers, she actually lives in Falmouth, but she covers all the way out through Plymouth and Kingston. And one of the things, it's not listed on her bio here, but she is very much involved with the Common Start legislation, which is the universal child care legislation for Massachusetts. So we are very interested in obviously hearing more about that. And I think hearing about just, how she's coped with the pandemic, what's going on with Beacon Hill now that we're a year into the pandemic as well. So please keep an eye out for announcements about that. Go to the website or check Kim's emails. I know she sent out that nomination form if you have a good nominee for the Health Literacy Award. So at this time, if anyone has any announcements, feel free to unmute yourself and share with us if you so choose. Anything going on out there? I know Kim sent something out for an event that happened last night, but I'm sure there's other stuff coming up. Check the chat. Oh, Kim put the nomination form in the chat, so you can access it there as well. One thing I will say in terms of health literacy, 2 years ago, Tom Comiskey, who's the outreach librarian at Plymouth Public Library, did put together a health fair, which was on a beautiful sunny October day. I think it was October, so it was in the fall, 2 years ago. And of course, we couldn't do that last year, but he has got approval to do the health fair again this year. So we're looking forward to that. It will be in the fall. Pretty sure it's the fall. But it was a great opportunity 2 years ago. And, we keep saying, hopefully things will be back to normal by the fall and we'll be able to meet in person like that. So we're looking forward to that. Any other announcements? Well, hearing none, I would entertain a motion to adjourn. Liz is just saying there's a NAMI support Zoom meeting tomorrow night. Where can people find out about that? On the NAMI website? Kathleen? Unmute yourself. There you go.
Yes, or you can just email me or call me and we'll send you a link to it. It's support for family members.
Great. All right. Is there a motion to adjourn? Maureen, thank you. Second, Katie, is that a thumbs up? Second. All right, all in favor? Opposed?
Aye.
Motion carries. Thank you all so much for being here. It was a great discussion. We did record it, so we will, hopefully by the end of the day, have the recording up on our Facebook page on our website, and we are going to try to track down those studies beyond the ones I put in the chat. So thank you all so much and have a great day.
Thank you.
Bye-bye now.